Our top story tonight. Experts are sounding the alarm over the state of our medical lab workforce, describing it as perilous. The New Zealand Institute is warning if nothing changes, it could result in delays or fewer services for Kiwis. Lauren Hendrickson has the story.
Lab workers are an essential part of our healthcare system, running over 200,000 tests a day. But that could soon be about to change.
The state of the workforce is perilous.
And it's dwindling too.
It's facing a tsunami of experienced senior scientists that are retiring and leaving.
Apex Union advocacy lead David Munro says that's because staff are underpaid and undervalued, and attracting new scientists and technicians is extremely difficult.
They come into a profession that's so strained that there's no capacity to retain them. The salaries simply aren't good enough. When you've done a 4-year degree, the prospect of laboratory science is just no longer appealing.
Our technicians are the poorest paid registered medical health practitioners that there are. A lot of them can earn more in a supermarket than they can in a laboratory, which is really an indictment on our health sector.
Lab workers were under intense pressure during the pandemic as they processed a huge influx of COVID-19 tests. In just 1 year between 2021 and 2022, there was an almost 7% drop in staffing numbers. Terry Taylor predicts that will continue to decrease and warns Kiwis could feel the ripple effect.
It's going to reflect in things like waiting times, diagnostic times. We will have to start deciding what services we can and can't provide in this country.
Taylor says he's spent 7 years pushing for change. Last May, he presented a workforce crisis document to Parliament, desperately calling for action. But he says little has changed. In a statement, the Health Minister says there's been good progress across staffing and pay equity issues. Last week, the broader laboratory workforce was added to the immigration green list, and the Ministry says it will be focused on building a more sustainable industry.
I really do feel that 2023 will be a year where we really regret how we've treated our pathology workforce.
A final plea for a major shake-up. Lauren Hendrickson, Newshub.